This is the case discussion for the session HIV Epidemiology and Testing in the United States with Natasha, Chida, and McKenzie. So case, a 30-year-old man with no significant past medical history presents to your clinic with 2 days of fevers, chills, and a diffuse maculopapular rash. 17 days ago, he shared needles with a friend, and on exam, he's febrile to 101 and also has palpable submandibular lymphadenopathy. You suspect he may have acute HIV. Question 1. What testing should you obtain to check for acute HIV infection in this patient? So the answer is obtain testing with a 4th generation immunoassay. And the reason for this is that the HIV-1 P24 antigen is detectable 2 to 3 weeks after initial infection. This patient had symptoms for 2 days and had an exposure 17 days ago, and so he may be in the window where an HIV-1 P24 antigen is detectable. I would note, however, that if the 4th generation test is positive, this doesn't rule out the possibility that he has had chronic HIV infection and his acute symptoms are unrelated, because remember, the 4th generation test will test for both antibody and the P24 antigen, and a positive result does not differentiate among which of those components of the test is positive. But because he's in the window where a P24 antigen may be positive, it's better to start with this rather than another test. So you obtain a 4th generation combination immunoassay which returns negative, and you are still suspicious for acute HIV. What is the next test you should obtain? So answer is to obtain an HIV-1 nucleic acid test. Most likely the 4th generation combination immunoassay will be positive 17 days into infection, but at times it can take up to 20 days to return positive. This patient had a likely acquisition 17 days ago, and so could be in a window where the combination immunoassay would be negative. And because you are highly suspicious for HIV, it is reasonable to proceed to an HIV-1 nucleic acid test, because this test can detect HIV RNA 10 days after infection. Remember, the HIV-1 NAT is the test that can detect HIV earliest out of all the available tests. So why obtain an HIV-1 nucleic acid test now rather than retest with a 4th generation assay at a later time? We've just noted that the 4th generation immunoassay usually will turn positive within 20 days of infection, and this patient likely had an acquisition of HIV 17 days ago. Why not just wait a few more days to retest with the 4th generation immunoassay rather than obtain an HIV-1 NAT now? The answer is because earlier diagnosis allows for earlier initiation of ART. So earlier diagnosis also allows us to counsel patients in terms of practices that can reduce HIV transmission to others, but also importantly, if we start ART earlier, we know that patients may have improved outcomes. So as we referenced in our session earlier, ART initiation during acute HIV infection can decrease HIV transmission, slow disease progression, reduce the size of the viral reservoir, and decrease the rate of viral mutation. Therefore, there is a significant benefit to diagnosing patients as early as possible, both to counsel them on practices to reduce transmission to others, but also to initiate ART at an earlier stage. So this concludes the case discussion session for our Johns Hopkins HIV Curriculum Epidemiology and Testing lecture. For if you have further questions, please refer back to the HIV Curriculum Epidemiology and Testing lecture, which is on the same website as this case discussion.